Well, hello again. It's Bob Boross, and this is my Jazz and Tap Dance Life. I'm chronicling now the process of having my knee replacement surgery. I did one check-in 24 hours after the surgery, still in the hospital. As you can see now, I'm at home. So after just one day, I was back home by 6 o'clock on Tuesday. And it's been a little bit of a journey, but it is getting better each day. So things are working well. So I'm going to talk a little bit about what I've been through, whether it's the condition of my leg, the medication, the therapy, what I'm doing there, and just how it's getting a little bit better each day. Okay, so I do have some notes, so I'm going to be like referring back to this just a little bit. Okay, in terms of what I'm taking, I've been prescribed oxycodone, which I only took for a few days. I haven't taken it since yesterday, and that's the more narcotic type of pain reliever. And I did need it on Tuesday night, but right now I'm doing well. And then I take Tylenol every 4 to 6 hours, and aspirin twice a day. That's more for a blood thinner. And I'm also taking Colace, which is a stool softener. And I'll talk about that in a second too, okay? But as for the condition of my leg, I mean, obviously, with all of the incision and everything that's been done, the cutting, it's swollen. It's really big, all the way down through my calf and to my ankle. It is a little bit better now, 3 days later, but initially it's like so tight. It's tight as a drum. It's expanded and swelled so that if you touch it, like it doesn't bend. Nothing. Your finger does not go into your skin. It's just, not that it's hard, but it's very tight. It's like a drum head. And from what I was feeling, I don't want to say pain-wise, but discomfort-wise, it was coming from that extreme amount of swelling. So the main thing is to get rid of the swelling as much as possible. So as you can see here, I've got a little device which keeps ice and the coolness on 24/7, although now I'm down to doing 30 minutes on and 30 minutes off. So I have an ice chest here, filled partially with water and the rest with ice. And then it runs down through this tube, and it comes in, and underneath there are little pathways where the water comes through, and it's very cold water. So I just keep that on for 30 and then take it off for 30 now. But this has been good. It's a little bit tough to manage that. Most of the time I'm on my own, but I'm able to lift it and get on top of the walker, bring it over to the sink, dump it out, put the new ice in, and get it back down. So this has been something that's really good for me in terms of getting rid of the swelling, because that's the main thing that we want to do. Now, in terms of pain, of course, everybody tells you that when you go in, you have a spinal, and then you have a nerve block in the leg, and of course, then they shoot lots of painkiller into the knee, because they will be cutting the bones on the top, cutting the bones on the bottom, screwing in the implant. From there, they tell you that usually takes like 2 days to wear off. So like I had it on Monday, so Wednesday is going to be the day. And they kept telling me, Wednesday, trying to prep me for it. Well, I would say Tuesday, actually it was Wednesday at 1 a.m. Wednesday at 1 a.m. I woke up, I only slept for an hour and a half, and I was starting to feel, a lot in the joint, more than I had been feeling before. So I took one of the oxycodones, and that's supposed to take 30 minutes or so to get better. Nothing. I took a second one, which is okay. And that made me very drowsy and got me to sleep for a couple hours. I woke up about 4 or 5. I took 2 more, and because I was still feeling it, I went back to sleep. But by 7 or 8 o'clock, I took a 1 at 7, 1 at 8. And after that, I was down to like what my normal discomfort was from before. So this tremendous pain that I was told that I was going to have, I felt some pain, but it was not this terrible, all-encompassing thing that was going to be with me for a couple of days. So whether that's my situation or not, I don't know, my tolerance, but right now I got through that okay. So for that, I'm very happy. Now the oxycodone is doing its job. You're supposed to take 1 before you do physical therapy, which now I'm not even doing that. Thing with oxycodone, it makes you constipated. Okay, so they give you the stool softener. That was not doing its job. But I took my last oxycodone yesterday at 11 a.m. 24 hours later, yes, today I had success. So now I'm a much happier guy right now. Okay, let's talk a little bit about the therapy. So my therapist comes in. She's been here twice so far, and mainly it's just to get the joint to bend. A lot of manual stuff where she's pushing on it and stretching it. a lot of stuff on my own. It's just very simple, lifting the leg up to try to work your quadriceps, to bend the knee in as much as you can. A lot of it is pushing your knee down to try to straighten your knee as full as possible. It's painful. It hurts. It hurts in the moment that you're doing it, like crying out painful. But it does get better after, 2 sessions with her and 2 sessions on my own. Like, I can do much more. I can tolerate more. I can move more. But there are just certain things, like just to have my leg straight in front and lift it straight up. Oh my God, the pain in your quad right above your knee it makes you scream out. It's something. But it's getting better. When I first came back on Tuesday into Wednesday, my first steps with the walker were like, walker, left foot, right foot, walker, left foot, right foot. By the next day on Thursday, like, I'm walking very easily from one foot to the other. And today I was walking just fine and really no weight at all with my hands on the walker. So that was good. That worked really well. So now I'm walking much better. I could probably walk without the walker right now, although I wouldn't try it maybe for another 2 days or so. But things are getting better, and actually today I got up and took a shower. That was nice. And I actually figured this out myself. I put the walker into the shower because I do have a handle to grab onto, but that's really not quite enough. So once I had that in there, it was very easy to just take a shower, get out, dry myself off. Of course, you wrap around with saran wrap. The bandage is supposed to be waterproof, but they tell you to put the saran wrap. Okay, we're back. Sorry, I had a little mishap there. So you use saran wrap on it and everything was fine. So things are going much better right now. I'm into my, Tuesday, Wednesday, Thursday, Friday. I'm into my 4th day from this. So things are good. I got a long way to go because I can walk, I can bend my knee, but I certainly can't move it freely. And that's something that will come with a lot of work and a lot of practice, okay? So what I'm going to do now is going to take me a moment, so I'll just stop for a second, but I'm going to take everything off of the leg and give you a little look at what's going on with there, okay? Hold on. All right, so let's start to take a look at the leg. Now, one of the things that I really do not like is I have to wear these compression stockings, and actually on both legs. They're skin tight, it's swollen in the leg, so this actually makes it very uncomfortable. I can take them off when I go to sleep, and that's just a wonder, but during the day I have to have this on. So let me try to pull this down, and you can see what's going on. And again, so this is the leg, and this is down in terms of the swelling. This is a little bit better, okay? So this would be the incision that was made to work on the knee. Now there's a spot here and a spot here, and that's for the robotic, I'll just call it mechanism, that actually does the cuts. It attaches here and here to provide stability, and then the device will move back and forth and the surgeon will make the cuts from there. Oh yes, and I didn't mention, I didn't really get a chance to talk to my surgeon because I got out so late, but he said everything went exceedingly well. It could not have gone better. So hopefully that's a good sign. And you can see in here, I have a lot of bruising in this part of my leg. And I imagine this is from the tourniquet. They told me a tourniquet was applied around my leg to totally squeeze so tight, that's to stop the blood flow, so that during the surgery, blood will not escape and you won't need a transfusion, which is what used to happen years ago. So I had a lot of pain here initially. It hurt here more than it actually did in the knee. But I've got a lot of bruising down in this area of the leg. As you can see, bruising in here. But it's starting to bend a little bit in the skin. I don't know if you can see that, but it was just rock hard as much as possible the other day. It's very warm. This is very warm, particularly in my shin, more so than in my thigh. But here it's very warm, and I guess that's just the swelling, and it's going to take time for that to go down. But in terms of the knee itself, there's not pain. It's discomfort from the swelling more than anything, and stiffness from lack of movement, but it's not something that is actually pain within the joint. And for that, I'm very thankful that that's not happening. But if I just place my hand here, this is considerably warmer than if I place my hand here on the top of the thigh. I find I spend a lot of time just lightly brushing back and forth, you know, that will feel good and feel calming as much as possible. So anyway, so that's what's going on. That's what's going on with the leg right now. So it's getting better. Took a shower today, used the bathroom today. That was a good thing. And walking better, and just got to go through therapy now. So hopefully I'll check in sometime next week, and hopefully things will be improved much better. Okay? All right, so thanks for watching. I know people have been saying great things to me, and I thank you for that. Just haven't been up to answering any of those, but maybe within the next couple of days, I'll feel good enough to sit in front of the computer and start getting into all of the nice things you've been saying, so I thank you for that, okay? So this is Bob Boross. This is my jazz and tap dance life. This is what's happened after 45 years of jazz dancing and tap dancing. This is what's going on. It was a little disconcerting for me feeling what I was going through with my leg and realizing, yeah, and then once I get this one done and get it back to 100%, then I have to do the other leg. So it's gonna be a 9-month journey, you know, to go through this, okay? All right, but that's it. I hope this gave you some information from a dance standpoint, and I'll see you in the next video. Thanks a lot. Bye.